Okay, everybody, we're going to go ahead and record this. Let's get over here to the concept introduction of infection. Okay, so the first thing that you need to make sure you realize is that here at UMSL, we are starting this new concept-based curriculum. As you have heard, we have 43 concepts that you will be introduced to, and most of those are being introduced in this very first semester across your classes. In one of your classes, you will receive an introduction to each concept. Some of those concepts are being introduced in health assessment, some are being introduced in foundations, and 2 of them are being introduced in the fundamentals lab section. So I'm going to go ahead and do that first one, which is infection. And this is won't be more than 10-15 minutes of a PowerPoint and discussion. And what you do is you go in and you print off the concept analysis of infection. That's always the first thing you do. As you go along and you get these, you need to print them off, put them in a folder of some sort, and be able to look back upon them when you need to. So let's go ahead and begin. Here's an example of that concept analysis, so make sure that you print that off and we will get going. So here's the definition. It's good that you read that definition and have a little bit of an understanding to it prior to class. So infection is defined as the invasion and multiplication of microorganisms in body tissues, which may be clinically unapparent or result in local cellular injury due to competitive metabolism, toxins, intracellular replication, or antibody response. So if you're anything like me, reading through that, it's like, okay, that's quite a bit of information. So we need to break it down. Some of this has already been broken down before in your A&P classes. Some of it maybe not as much. So we're going to go in and make sure that we're all on the same page with this before you come to class. Now I know on this first week, a lot of you might not see this right away. So it might be after your first lab when you actually read about some of this. But normally in the future, you want to make sure that you're looking at these concept analyses before you come to class. So what are the antecedents? So what is an antecedent? An antecedent is basically something that causes something else or leads up to something else. So in this case, what is leading up to an infection? And that would be anything that causes an infection. So we look at our pathogens. Okay, the main ones that we have here are the bacterial, so that can include things like the Staphylococcus aureus or the E. coli. We have fungal, which is your molds and yeasts. Anything viral, which could be organisms that use the host genetic machinery to reproduce. So this would be things like HIV, hepatitis, herpes. And then we have the parasitic, which is like the worms and stuff. And so having a clear understanding of those, knowing those before you learn more about infection and how we can prevent infections is very key. So how do we go on? We have to know the chain of infection. If you don't understand the chain of infection, it's going to make it really hard for you when you're trying to break the chain. So we start with the organism. Again, our organisms are the pathogens. The bacterial, the virus, the fungus, the parasites. We need to know the causative agent, the organism. So once we know that, we need to go to the reservoir. So how is it going across? How is it getting from one place to another? Is it through a human? Is it through an animal? Food products, organic matters on inanimate surfaces? Is it happening through water, soil, insects? So you're kind of getting the hint there. Then we can move on to the portal of exit. So this is from the means for leaving the host. So this could be through the respiratory tract when we are coughing or breathing. And that would be considered our droplet or airborne precautions. Is it happening through the gastrointestinal tract, the GI tract? That could be happening with things such as like hepatitis A. Is it happening through the genitourinary tract? the GU tract. So that would be things like E. coli, again, hepatitis A, herpes simplex virus, or like HIV. Is it happening through the skin or mucous membranes? This could be things like herpes simplex or varicella. And then thinking about the portal of exit as being blood or body fluids. And again, that could be things like HIV or hepatitis B and C. Okay. So the next thing after the portal of exit is the transmission. So this is basically our mode of transmission. How's it getting to somebody? So that we have the contact, which is direct physical contact. That would be person to person. There's also the indirect contact with an inanimate object. So this would be object to person. So that would be like me touching a table and then walking away, and somebody else coming up and touching that same part of the table, and then it getting into their system that way. Then maybe them not washing their hands and then putting their fingers in their mouth. It would be, there's also the fecal oral transmission. That's handling food after using a restroom and failing to wash your hands. And then there's the droplet precautions. So that's like sneezing, coughing, and talking. We also have our airborne, which is again sneezing and coughing. The airborne, though, we would have to wear a different type of mask. We call it the N95 mask. So if it's actually airborne, we have to wear a specific mask. If it's a droplet, there's just a regular mask that we can put on. And then there's the vector-borne, which is through animals or insects as the intermediaries. So this is when we get things like get diseases from ticks or mosquitoes, because they're transmitting different diseases. Like mosquitoes can transmit like the West Nile and malaria. Okay, so after that transmission, once we have an idea of those, there's the portal of entry. So that's to the host. It might be the same as the portal of exit. So just understanding where it's going into somebody. And then lastly, our vulnerable hosts or susceptible hosts. That's somebody who's usually compromised with their defense mechanism. They're immunocompromised. They might have a break in the skin. And a lot of the times then this leaves the host or the person more susceptible to infections. So having an idea of your vulnerable populations is really, really important. Okay. Then kind of having an understanding of the different stages of an infection. So there's the incubation period. That's the interval between the pathogen entering the body and the presentation of the first symptom. We have the prodromal stage, which is the interval from onset of general symptoms to the more distinct symptoms. During this time, that pathogen is in there multiplying. It's growing. Then we get to the illness stage. That's the interval when symptoms specific to the infection occur. You're getting things like your fevers and redness, swelling, pain, heat, things like that. Our lab values, such as our white blood count, is going up. We have an increased erythrocyte count, an increased sedimentation rate. We might have nausea, loss of appetite. So lots of different things could happen. And then there's the part towards the end where the interval where the acute symptoms disappear. And that total recovery could take days to months, just depending on not only the person and what's going on with them, but the disease itself. So, I mean, we're looking at a lot of different factors when trying to help somebody decide when they're going to get over something. And that's why we have to say things like it could take days to months. If I had the flu, it might take me 5 days to get over it, versus somebody who is maybe a little bit more immunocompromised, maybe has cancer, or an elderly person, or even a small child. It might take them longer than those 5 days to get over something like that. Okay. So characteristics, what do we assess? So once we have that whole chain figured out and understanding it more closely, we can look at the defining characteristics on that concept analysis sheet for infection. And this is what we're looking for as nurses. Okay, and I know this is a lot to remember and a lot to look at, but always just kind of think of it as you're just looking at a person. Okay, this is a real live person. If you walk in a room, what's the first thing you notice? Are you coming in and thinking, okay, I have to go in and I have to say hello to them, and then I have to get my vital signs, and then I have to do a bath? And if you look at it like that, you're gonna miss things. Treat the person like a person, and you will see a better picture of what's going on. When you walked in the room, were they smiling at you? Were they talking to you? Were they breathing heavy? Did they look uncomfortable? Or did they look, anxious? Things like that are so important to us nurses. Okay. And you can absolutely go back and look at your A&P. Again, this is huge for knowing your A&P. So once you kind of have gone through everything, you're still going to probably need more. You maybe still don't understand. So you have to have the basics of infection before we can use examples. So on the same concept analysis sheet towards the bottom, it has exemplars. That's another fancy word for examples. So you'll see what examples or exemplars we're using in every single class if it's going to be used in a class. And you will notice that we don't repeat them. We use new ones. So basically you are getting that foundation of infection right here from the start. You must know that and understand it. And again, there's 43 concepts that you must have a basic understanding of, so that then we can take all these exemplars and keep applying and driving home the concept of infection. That way, when you get out in the hospital and you see other diseases and other processes happening, it doesn't matter what type of infection a person has, you're still going to have the basic concept of what to do. Okay? So YouTube is amazing. Simple Nursing is a fun one. This gentleman is very energetic, and a lot of our nursing students seem to like some of the things that he puts out there. So I always think it's best to not only just listen to this little introduction here, but you've got to find other ways that you can get this concept, any concept, to make sense to you. We all learn differently. Also, peer tutors are amazing. Get with another person in the class. Even if you don't like to study with another person, it's great if you talk through things. Just as you're going down this concept of infection, this concept analysis, when you're looking at the defining characteristics and it says things like weak immune system, what does that mean? What does that mean to you? What does it mean to your friend? So talking through things like that, that's studying, okay? That's what you're going to have to do during nursing school. Okay, other sites that help you drive this home, the American Nurse Association. Here's a couple links I threw up. It's always a great thing that you can go to, great resources. A big thing about nursing is we have to know our resources. We have to know where we can find the information. I absolutely guarantee there's not one nurse out there who knows everything. We are always learning something new every day. Things change constantly. The words we use seem to change constantly also. For instance, with infections, we used to call nosocomial infections when they're in the hospital. They often occur in the intensive care unit. Let me see what else I can tell you about them. It's formally called nosocomial infections. These can come from a different source, from outside the client or inside the client when the part of the client's flora is altered. So we don't even call them nosocomial infections anymore, though. And they're acquired while receiving care in the healthcare setting. So that's what I always grew up knowing they were nosocomial infections. But now they're called healthcare associated infections. So the words change. That does happen, and that's why we are constantly learning new things. So just understand that those things are that just kind of is why we as nurses go with the flow, and I tell you that there's never anything that's absolute, because there's a lot of gray area everywhere. So I hope this is kind of a nice little introduction to what it will be like when we are introducing these concepts. Your lab faculty will hopefully help drive this home as well. So as you can see, though, our very first in fundamentals clinical, I put clinical, but it's more like in the lab section as well. You're going to be practicing aseptic technique, hand hygiene, hygiene in general, and then isolation precautions. That's the main thing you're going to be doing in lab this week. So keep that in mind, and I hope that you guys have a great first week of school. Take care.